Contrary to popular belief, yes, you can break your penis and no, there's no bone inside. But if you tear the protective tissue during an erection, then it is a serious surgical emergency. So here's what I need you to know. Penile fractures involve rupture of the tunica albuginea around the erectile tissue, commonly during intercourse or trauma, and it requires immediate medical attention. It's one of those things that you cannot wait to get taken care of. You got to go to the emergency room. Yes, yes, yes. So let's demystify the science. During an erection, the area called the tunica albuginea, it thins from about 2 millimeters to just 0.25 to zero point 0.5 millimeters, making it vulnerable. And a sudden blunt bend can cause a tear, leading to blood leaking into the surrounding tissue. Now, the integrity of the tunica albuginea is critical for erection. So that is one of the most important areas. And you have to be able to recognize this as an emergency. This is not something that can wait. So here's what often happens during vigorous sex, particularly like what we say misaligned thrust. You might hear a pop or a feeling of intense pain and experience of an immediate loss of erection. And then what follows? Swelling, bruising, and then what's clinically called the eggplant deformity. So just remember, if you hear a loud pop, pain, swelling, and an eggplant like purple discoloration of your penis area, you have a problem. You need to get to the emergency room. Now, sex is the most frequent context for this type of injury, especially during certain positions where maybe a woman is on top or a doggy style or just vigorous thrusting. But it can occur in any position. And then other causes are aggressive masturbation, if you roll over during your sleep onto an erect penis. And then cultural practices like forceful bending also can be a cause of it. So just understand that misaligned thrust leading to contact with the partner's pelvis or perineum are common causes. And it's also one of those things that you are going to have to go to the emergency room for. This isn't something that you can wait until the next morning to get taken care of. If you suspect a broken penis or a penile fracture, then do not wait. Immediate surgical repair can significantly reduce complications like ED or erectile dysfunction, painful curvature, or a long term deformity. There are some non surgical approaches that can carry rates of up to like 50% of complication, but surgery reduces the risk of complications down to about 11%. So just know that the more time that you wait, it can cause complications. Emergency surgery is the standard of care. Now, remember this, the diagnosis is often clinical. So it's based on, what you tell the doctor and then what your penis looks like. So in uncertain situations, you might get some ultrasound or like a MRI, something like that, but your treatment shouldn't be delayed waiting on those. It's important that you actually get care from a physician. Clinical diagnosis is important. You need to have a professional take a look, examine the situation, and also let them know what was going on at the time of your injury. So when someone has surgery for this, typically it's going to repair the area I was talking about, the tunica albuginea, and it's going to repair any tear and any other injuries. Post-op recovery is usually favorable, and then a lot of men regain full function with resumption of sex in, maybe about 6 to 8 weeks. But scar tissue can lead to curvature or other complications. So it's important that you have timely surgical repair to get your function back. Now, I'm Dr. Erica R. Jones, MD. I'm a board certified family medicine physician. And if you like this video and you found it to be helpful, then make sure that you like the video and also subscribe for more tips. And then lastly, I want to bust a myth for y'all. No, your penis does not contain a bone, but this doesn't make injuries to the area impossible. So you have to communicate clearly during sex. You want to avoid some risky positions or overly vigorous thrusts, and never attempt forceful bending. That's not something that you want to do. Some cultures do practice that, but just know that knowledge and mindfulness are going to be your best protection.